I'm not surprised that the majority of the population don't want to exercise. And our brains are naturally designed not to want to exercise. That's a very common mistake, and we do that because it feels easier, because we're engaging less muscles.
Welcome to the Visionary podcast, where we discuss science, medicine, physical health, and mental well-being. If exercise were a prescription on the NHS, what would be your top 3 exercise prescriptions for the general population? And tell me why. 3 main exercises.
So I'll always go based on, I'll always advise 3 categories of exercise. So cardiovascular, all right, so getting the heart rate up.
Huffing and puffing.
Huffing and puffing, yeah. The second thing I'd always recommend is some form of strengthening exercise. And then the third thing I would recommend is something geared more towards balance and flexibility. So these are the 3 category of exercises I always think of. And obviously there's various different types of exercises you can do within those categories. So if you wanted to go into more
please,
detail,
just briefly. We know the cardio, like the tennis, the racket sports, the running, these kind of, or maybe aerobics, right? But I'm still not clear on the strength. The only example I know is lifting weight. Is let's say using bands with Pilates could be considered strength. What other examples?
Strength exercise basically involves any movement that where your muscles are contracting against some form of resistance.
Strength is the same as resistance exercise?
I would say resistance exercise is a form of strength exercise.
Okay.
Yeah. So anything that involves moving, engaging a muscle with some form of resistance or weight, or even your body weight can also count for that. So and again, it's very person dependent. It's very condition dependent. One thing I'll always try and fit in my prescription around what the patient, I feel the patient wants, or what the patient can physically do within their weekly sort of routine. So most patients I see are desk-based. They have very, very busy lives. They work from home.
Apart from you, because that's your job.
But very busy working from home. A lot of them have, children or a family life, or, relatives they're looking after. They have to do the cooking, the cleaning. Life is busy. So I'll always try and recommend something that patients can fit into their daily life easily, particularly if it's someone who's never done any strength exercises before. I try and ensure it's something that's they can do maybe in the comfort of their own home, or an environment they feel comfortable in, and something that's not going to create too much injury risk. So there's actually a lot of evidence. There was a massive systematic review and meta-analysis done. So that's where they collect lots of randomized control trials, and they kind of look at all the evidence from these trials and come up with a one solution or one kind of bit of advice from all of these studies. So it collates lots of really good evidence together. And this, it was an international study, and it essentially looked at isometric body weight exercises. So isometric is an exercise where the muscle is contracting and under strain, but it's not shortening or lengthening. So you can have 3 different types of strength exercise. You have a concentric exercise where your muscle is shortening as it contracts. So this, for example, take a bicep curl. If you're doing a bicep curl with a weight, that bicep is shortening as it contracts. Yes. Okay. And then similarly, if you were to then do the opposite of a bicep curl and straighten your arm out, but doing it in a very controlled and slow manner, the bicep is still, under strain. It's still working hard, but it's lengthening as it does that.
And that's a good thing.
Both of them are good. They're good for different reasons. An isometric exercise is when your muscle is contracting, but it's not shortening or lengthening. So for example, take a shopping bag and hold it in your hand, and just hold it like that with your elbow at 90 degrees. Your
That's
bicep
still strain or pressure.
There's still strain there. Your bicep's still working, but it's not moving. So that's called an isometric exercise. Now, the evidence from this randomized control, the meta-analysis and systematic review that was done showed that there's 3 isometric exercises that work really well to reduce your blood pressure. We can try some of them now if you want.
Yes, please. That would be really, really helpful. Yes.
So the first exercise is called an isometric wall squat. Okay, so if you put your back against the wall and then start walking your feet out, keeping your feet about hip width apart, and then start to slide your back down the wall into a squat. And what you're aiming for is all your lower limb joints to be at 90 degrees. So the ankle is at 90 degrees, the knee is at 90 degrees, and the hip is at 90 degrees. And then you just hold it for as long as you can. Normally I'd recommend about 30 seconds to start with. But again, even if you can just do 5-10 seconds, that's great to begin with. Take a rest and then repeat it again, and do that 3 times. Again, the more you can do this throughout the week, the better. And there is evidence that it actually reduces your blood pressure. Little caveat, I wouldn't recommend doing this if you have an acute injury. So particularly any ankle, hip or knee problems. If it causes pain, then absolutely don't do it.
The other 2 exercises, please.
So the second one I'd recommend is an isometric leg extension. So it's going to be quite difficult to actually demonstrate here, because you need a chair that's fixed. So it can't be a chair on wheels. An armchair is good, or just a normal sort of desk chair that doesn't have wheels is great. But essentially what you want to do is sort of line up your chair so it's facing a wall, or there's something in front of you that's really, really heavy that you can put your feet underneath, so the top of your feet underneath. And then what you're trying to do is trying to push yourself away from that wall, or you're trying to lift up whatever your feet is underneath. And that engages your quad muscles, and you're holding that position. So you have to make sure that you've got a stable chair, a stable base that you're sat on, as well as something that's very heavy that you're not going to be able to physically pick up, but something that you can really push the top of your feet up against. Yeah. If that makes sense.
Yeah, it does. It does. The third one?
And the third one is an isometric grip strength or grip hold. So anything that is, not going to squash, that you can hold in one hand. So it could be a tennis ball, it could be you can get stress balls as well, or even the cricket ball, rounders ball, hockey ball, whatever. But something that you can physically hold in your hand and squeeze, and that safely. But yeah, essentially you're just squeezing that
and
thing.
I'm working up my arm.
Yeah. So you're working out all of your arm muscles, basically, particularly the flexor muscles in your forearm and your bicep. Again, you're holding that position. Just start with sort of 10 to 30 seconds, rest, and repeat 3 times. And then you're gradually trying to increase the time you can hold these exercises for. So you're trying to aim for as long as you can, really. And then the more you can hold it, the stronger you're getting.
Okay. Would you call these 3 exercises strength training? Yeah. Okay.
Yeah. So it's a form of strength training. And obviously there's no weights or anything like that, but you are training your muscles. You're increasing the strength and the endurance of your muscles. So it is a form of strength training. Absolutely.
Hi, I'm Hella, your host today. If you're enjoying what you see, please hit that lovely subscribe button. It would mean a lot to me and my team. Or maybe it's more now. We're still learning, we're still finding our feet, but with your support, we can build this channel. Let's take this journey together, one step at a time. Thank you so much for being part of it. I'm a big fan of yoga and Pilates, and I aim to do Pilates every day. It doesn't happen every day, but I was advised over and over again, and I hear it always in podcasts, I have to start building muscle mass. I'm 47. I've never lifted weight before. And every Saturday, we talked about routines and calendar entries. And I had that calendar entry in my calendar 5 months ago to lift weight every Saturday. And I see the notifications. I swiped it away and do nothing about. My nerves are so insensitive to the notification again, and I wouldn't let go. I kept it, but I do nothing about it. I think mainly because I haven't done it before, and I'm worried maybe I might hurt myself. It's how do I do it? How do I pick the YouTube thingy? I don't have the time genuinely to go to a gym and do things, so I'll have to do it at home, the way I do my Pilates. But you're telling me here that strength training or resistance training is not always about weightlifting. Yeah. I can do small things to build muscle mass. Yeah. And I also saw glimpses of things I might do in yoga and Pilates as well. So this might count, hopefully, right? As building muscle mass.
Absolutely. Yeah. So generally, when I think of strength training, I split the body up, and you've got your arms and your upper body. So that's everything from your fingertips through to your shoulders. And then you've got your core. So that's your abs, your back muscles as well. And then you've got your legs. So that's your calf muscles, your quads, which is at the front, your hamstrings, which are at the back, and your glutes and your bum muscles. So when I think of strength training, I think of these three groups. And I try and choose exercises that incorporate these three groups. Again, choosing what exercises is can be tough. You know, I sometimes struggle myself to kind of pick what exercise I'm going to do and the structure I'm going to do them in. Good ways to start are online fitness coaches. It's very difficult advising which ones to use because, again, it depends on the style, whether you prefer female or male coaches, and also their kind of background as well as their qualifications. And it's really hard to know that. But I would try to go for, online videos where you actually see the instructor doing the exercise.
Yeah.
Ones that teach you through the technique. So you don't want an instructor that just shows you a video of them doing it. Ideally, you want them to be advising you exactly what position your body you should be in. And there are, with every exercise, there's very common mistakes that people make naturally because they make it because it makes the exercise feel easier.
Yeah.
Take a sit-up, for example, an abdominal crunch. I would say the common mistakes with that are, as people lie flat, their back arches up off the floor and they try and sit up using their kind of almost arching their back. That's a very common mistake. And we do that because it feels easier, because we're engaging less muscles. Okay. So
what is a correct way to do it for my lower back to hit the floor?
Yes. So with... and again, a good Pilates instructor, for example, will probably tell you this, but it's when you're lying on the floor with your legs bent and your feet flat on the floor, make sure that before you start the exercise, before you start the crunch, that you are pulling your belly button down into the floor, that you're tucking your pelvis under and you're trying to push your lower back into the floor. Then by doing that, you've already engaged not only your abs, which is what we obviously think of when we say core, but actually you've got a lot of deep core muscles that are deeper than your abdominal muscles that are around the lower back as well. And by doing that basic movement to begin with, you've engaged all of those muscles. And then, as a Pilates instructor would probably say, vertebra by vertebra, you gently bring your shoulders up and you can come up into the sit-up position. But yeah, you really do need to be kind of engaging the core properly first before you do the exercise. So any instructor that explains that, that's just one exercise, but you really want them to be going into detail as to what you should be doing and the common mistakes that are made and what to avoid. But yeah, I mean, there's obviously big names like Joe Wicks and things like that. And I think he's great.
Yeah,
so
really.
If you want a name, then that's great. But
I was under the impression that he only does cardio. No, he does Pilates as well.
Oh, that's a good question. I know he definitely does core and ab workouts.
Okay.
And I think certainly it's good. It's a good place to start. He does a lot of whole body workouts, circuit type training, HIIT type training. So, but even if you do it slowly to begin with, without any extra weights, his training is just very simple, and it's done at home, and he does it in the comfort of his own home, which means you can do it in the comfort of your own home. So, it's quite a common name that people have heard of that it's a good place to start.
Yeah, absolutely. Yeah. Now I've started doing Pilates while my child is doing her 11 plus lesson right in the tutor's living room. I was very self-conscious asking at the beginning, but she was lovely about it. And that's how I do it now. Yeah, on that specific day. We're all time poor. Let's talk about that famous sentence, I don't have time to work out. That's totally me. I say it all the time. And I'm sure you have heard so many patients saying that. How would you convince me that exercise is as important as brushing my teeth, having a shower in the morning? I might need some convincing that I do need to do something sometimes, because I might be busy. A whole week is gone. I haven't done anything.
I think a lot of it comes down to prioritization of time. And I don't want to say people use it as an excuse, because I also say, I don't have time. But we know exercise is quite hard to do because it's not comfortable. When you do it, you are going to get out of breath, you're going to get sweaty, you might cause a small amount of pain in your muscles, or it feels uncomfortable when we do it. And our brains are naturally designed not to want to exercise.
Really?
Back when we were hunting for food, and we, food wasn't always on the table, obviously our survival instinct is to conserve energy. So if we were to design to want to exercise, we would have burnt all that energy before we could get a meal.
Yeah. And back
we
days,
probably
and
wouldn't be
hunters and gatherers were exercising by walking and running
But that's
after
because
rabbits
they had
anyway.
They had to gain that, to get their food. So there is a almost evolutionary theory that we aren't designed to exercise, and it's a natural survival instinct not to want to
preserve
exercise.
energy.
So to preserve energy. So I'm not surprised that the majority of the population don't want to exercise. And there are times, particularly when we are feeling tired, when we're not prepared, when we're not in the right mental state, we're in survival mode, essentially. It's normal to not want to exercise. And that's our kind of survival part of our brain telling us, oh, don't exercise, take a seat on the sofa, rest, But of course, we're no longer in that situation where,
we're not striving to survive.
Exactly.
We already have food in the fridge.
Exactly. So we do have to use the higher reasoning part of our brain to sort of say, okay, well, these are the benefits of the exercise. When I start, I'm going to feel a bit uncomfortable, but I'm going to feel much better afterwards. And then if we think about the long-term benefits that we mentioned at the start, that can also motivate us to start exercising.
It's putting the time and effort in the short term, then dividends will follow later, right?
Exactly, yeah.
Have you ever seen a condition that was dramatically improved with exercise, a level of improvement that even surprised you?
Yes, yeah. I mean, I've seen patients with sort of really bad back pain. So they've, just bent forwards or slightly twisted in the wrong way, and their back's gone into spasm. And, they've come into my surgery and they've not really been able to walk properly. They've struggled to get from sitting to standing. They've struggled to move over to the couch so I can examine them. They've struggled to then lie down. Their mobility has been really limited because of this sort of back pain that they're getting. And most of the time, this back pain will ease with movement. We say that, backs need to be moved. Obviously, we rule out all of the more serious things it could be. And the majority of the time, it's not anything serious. So we advise the patients to go home and start gentle exercises to help. And this could be very simple things, like when we mentioned earlier with the, when we were talking through the abdominal crunch exercise, and just lying there and really tucking your pelvis under, pulling your belly button into the floor, things like that, with your knees bent. So lying on your back with your knees bent and your feet flat on the floor, gently moving your knees from side to side like a window, a windscreen wiper, very gently, again, as pain allows. Your back will thank you for it. Other similar things, again, you might have heard of it in yoga, but the cat-cow positions, I don't know whether you've heard of
cat-cow.
Cat-cow.
I know down dog, facing dog.
Cat-cow is when you're on your all fours, so you're on your knees with your hands on the floor.
The back is
exactly
a cat.
So you're on all fours, making sure that your wrists, elbows, shoulders are stacked on top of each other, so you're not your hands aren't too far out in front or too far underneath you. And then putting your chin to your chest and bringing your belly button up to the ceiling, so you're kind of really arching, through the back, and then other way your chin lifts, and then your belly button, try to get your belly button down to the floor, and that can also very slowly again help with your back. So it's these very simple exercises that gets people moving, and it really sort of helps to reduce the spasm in the back and can really help their back pain more than pain relief can. But sometimes we need some pain relief so that can actually start the exercises, and that can be a really useful tool. But generally it's the movement that really helps. And then I see patients a couple of weeks later and they walk into my clinic good as new.
Are there any misconceptions about exercise that you would like to clear up with us today?
I think a big thing as well is the safety aspect. Both healthcare professionals actually, as well as patients, when you start to really look into the barriers behind why either patients aren't wanting to exercise, or why healthcare professionals advise against exercise, or they don't recommend it, or they don't bring it into the discussion, I think is a they're worried about the safety of it. I mean, we see it with injuries. You know, a lot of the immediate injury advice is to rest. Actually, not necessarily.
No. Yeah, we'll talk about
when
that.
we're ill, you know, we have a cough or a cold, people go, oh, rest up, you'll be okay. Now, obviously, there are some elements, some illnesses where absolutely rest is key. You know, I'd say if you have a fever, for example, you know, then absolutely you can rest. But a simple, you know, cough or a cold, actually, there is some evidence to suggest that resting too much could contribute to post-viral fatigue. You've heard of long COVID?
Yes.
Now, again, the evidence is not substantial, but there might be some evidence to suggest that resting too much with a virus might contribute to physical deconditioning and fatigue levels following the virus. Look, you do have to be careful, don't get me wrong, but certainly, and it's the same with elderly patients as well. You know, we have a lot of elderly patients who are a bit unsteady on their feet, might be prone to falls, and I think there's quite a consensus that, you know, that they shouldn't be doing any exercise because of the risk of them falling and injuring themselves. You know, obviously we have to take that into consideration, you know, a person's falls risk, but there are still exercises that you can do sat in the chair that doesn't involve getting up and potentially falling. It's just thinking outside the box and thinking of exercises that the patient sat in front of you would be capable of with as little risk as possible. Change.
Debunk now.
Yeah.
Hearing you saying that, I remember in my forever pursuit to come up with innovative ways for recovery after workouts, I once asked ChatGPT, sorry to cite ChatGPT, but ChatGPT advised to partially recover from the strain of a run is to actually go for another gentle run or shorter run to ease the pain after the first one, to go there as soon as possible. Does this ring any bells? Is there any truth to that?
Interesting. Yeah. So I think what that is something we would call active recovery. I don't know how quickly ChatGPT was advising you, or how soon after they advised going on a run.
Because I was saying that I only have the time at the weekend, so I like to work out Friday afternoons, Saturdays and Sundays, not to be totally sedentary during the week, but this is a window where I have most time. How do I do this quickly? Because I don't want to wait for days till my muscles bounce back. So that's okay, run afternoon on a Friday, okay, the following day by midday I want to have another run and not struggle massively. So he said make it gentler, or in the morning do some
so you mean
work.
the next day?
Yes.
So not sort of do the run, wait half an hour and do another. Just clarifying, fine.
The following day.
Yes, I mean that's something we call active recovery, which can be very beneficial. So yes, normally after you've exercised, there will be an element of muscle breakdown, muscle damage, which can cause a little bit of achiness in the muscles, which in scientific terms is called delayed onset muscular soreness, or DOMS. That's normally about 1 to 3 days after the exercise you've just done, and you feel that kind of achiness in your muscles. We see it a lot more with kind of strength training. So if you've lifted heavy weights, the heavier weights you lift, the more muscle damage you do to then rebuild that muscle and make it stronger. So yes, to help with DOMS, you can increase blood flow to the muscles again and help those muscles recover and warm up again. And that might involve going on a walk, some light yoga, a gentle jog, absolutely very gentle. But this can help, with the muscle soreness for sure.
Let's talk about injuries, the dreaded ouch. Injuries are almost inevitable for active people. I've had my fair share of them. Do you see injuries that might surprise people by how easily they happen? Like I bent down a little bit, or it was just a small twist. What do you think might cause this?
I think definitely sort of the most common injuries we probably see are ankle sprains. And I think people, particularly if they've already had one ankle sprain that haven't rehabbed it properly, a lot of people have the term, I have very weak ankles.
Yes.
And that generally is because they've not done the proper rehab with the strengthening and the proprioceptive work afterwards. We can go touch upon that a little bit later.
Was that what you would call chronic injury?
Not so much. So that would be a case of an acute injury, so an ankle sprain that then hasn't been rehabbed properly, which means then the biomechanics in the ankle and the foot and the lower limb has changed slightly, and the ankle is, weaker, and then that makes you prone to more acute ankle sprains. So I'd probably say that ankle sprains is definitely the most common and probably one of the easiest kind of injuries to have in most sports. But I think certainly the lack of people get very surprised about the fact that it carries on happening. So it's a recurring injury that they get because of, again, the rehab is actually much more intense, and we have to take the rehab much more seriously than we think.
So how would you define a chronic injury? I usually struggle with my Achilles tendon, the left one. Would that be an acute injury or a chronic injury? It just flares up over and over again.
Sure. So I'd probably describe that as a chronic injury. So in general, an acute injury is something that happens quite suddenly, quite quickly, as a result of a sudden sort of incident, one moment in time. For example, you go over on your ankle and you feel pain down the side of your ankle, the outside of your ankle. That would be an acute ankle injury. A chronic injury tends to be something that comes on quite gradually, normally over the course of a few weeks to months. Certainly in the case of back pain, we would start describing back pain as chronic once it's been persisting over 3 months. So again, it varies depending on the body part, but in general, a chronic injury tends to be something that comes on quite gradually, gets worse the more you do, and then the intensity and the severity of the pain gets worse over time as well.
Can I possibly break that injury cycle? I guess I'm asking if I should prepare myself emotionally to manage my Achilles tendon for the rest of my life. What should I do to fix any acute injury? A journey of rehab?
So acute injury or a chronic injury? Chronic, yes. So in the case of Achilles problems, so Achilles tendonitis, or what it tends to be called now as Achilles tendinopathy, your tendons are in a sort of constant state of change. So when we exercise, we get a little bit of damage to the tendon, just micro tears, for example, that then repair themselves, and we carry on. So we don't feel any pain when that happens. That's just a natural part of the tendon and how the tendon works as it stretches and compresses with activity. When the tendon gets overstrained or overstretched, and it's there's too much work, so too much stress or strain put through that tendon, and we don't give it enough time to heal, that's when we start to get problems like pain. And it starts off with inflammation in the tendon, so a tendonitis. So it starts off with inflammation. If we don't give that inflammation time to heal and settle down, the tendon then starts to reorganize itself, and then you start to get a very poorly organized tendon. So the cells in the tendon become poorly organized, and that's when we get what we call a tendinopathy, which is a much more kind of chronic picture, chronic injury, where we get chronic pain, so pain that lasts more than 6 to 8 weeks or whatever. In order to treat this, we have to reduce the strain going through the tendon.
Rest to begin with.
So rest to begin with, to get rid of any kind of residual inflammation. And then we need to put the tendon through a set of exercises that starts off very, very light and then gradually builds up in intensity as the muscle and the tendon strengthens. But in particular with tendons like what we call eccentric exercises. So as I mentioned before, they like exercises where they're being put under strain, but as they're lengthening. So for example, with the Achilles tendon, starting up on a tiptoe and then gradually flattening the foot down, we would consider that an eccentric exercise for the Achilles tendon. And Achilles tendons, or tendons in general, like those eccentric exercises. But again, we have to start very light, trying with a very low load through the tendon. So that probably means taking most of the body weight through the other side. So if you've injured your left Achilles, it will be taking a lot of your body weight through the right side and then gradually build up as pain allows. But unfortunately, Achilles tendons are quite tricky to treat because obviously we use them all the time to walk, to climb stairs, to go up on tippy toes. So
How do GPs usually support patients with sports injuries, let's say from the initial assessment down to the rehabilitation journey?
Although all GPs are generalists, a lot of GPs do have special interests in certain areas. So I think it's very dependent on the type of GP that you're seeing and what their personal interest is. You're more than within your right, to ask when you're booking an appointment about a sports injury, are there any GPs who have a special interest in sport or musculoskeletal problems or joint problems or whatever. Some GP practices might actually say, oh, well, we actually have some physios who will happily see you. Mm-hmm. And actually they can put you in with a physio to see a physio rather than a GP. And actually physios are amazing. I mean, this is what they do day in, day out. They see and assess joints and muscles and tendons and sports injuries and things like that. So, just because they're not a doctor doesn't mean that you won't get good care. So I think there's a lot of what we call first contact practitioners now, or FCPs. I know that our practice in Tunbridge and there's, I think, 5 practices in Tunbridge that all work together, and we share these the FCPs, their first contact practitioners, physios by background, but they don't need a GP referral to see you. If you've got a problem with your back or a joint or a muscle or a pain somewhere in your body, they will see you, and you just have to say, can I see an FCP?